We're gonna call to order if we stand.
Wait a minute.
No, what?
Yes. JPS is first.
Oh, I thought that this one was.
Oh, no. JPS is always going to be first.
Well, then I don't call it to order.
Wow.
You did.
You did. Never listen to a lawyer anyway.
I second that,
They do both today. Fine.
I told him I wasn't going Wednesday night and being on, having HHS on.
My same night
Unless you brought your pajamas?
unless
How are you gonna roll your eyes if I don't go first?
Well, 'cause
once I'm done, if it gets into one of these 2-hour meetings like they normally do, nah. Okay, it's 4:00, name for the pledge.
I'm protesting.
I pledge allegiance to the flag of the United States of America. And to the republic which stands one nation under God, indivisible, with liberty and justice for all. Remain standing for a moment of silence, please. Thank you.
You know what I mean?
I thought that, but then it's.
Yes.
Welcome to the new year, 2026, our first JPS committee meeting for the year. Roll call, Legislator McNabb Pullman.
Present.
Legislator Petter. Here. Legislator Winslow.
Here.
And myself. I did not get notice that Ben was excused, so I'm assuming he's still out on vacation or whatever. So we have enough for a quorum. I do have minutes for approval. The December 2nd, 2025 JPS meeting.
I'll move him.
I'll second.
Have a motion and a second. Any discussion on the minutes from 2025? Hearing none. All in favor?
Aye.
Any
I
opposed?
don't care.
Approved. This is for information only appointments. There is Mr. Dave Perkins for the PROC committee. Mr. Perkins is with us today. The Traffic Safety Board, we have Darren Walwonder and Susan Azzarelli, I believe. I hope I didn't butcher that name. That is just for information. They will be voted on and approved at full ledge. That brings us right up to department updates. We'll start right off a little bit different order, only because the district attorney has another engagement later on this evening. So we'll have her first, Brittany Ancalacci.
Good evening, everyone. Just a couple updates. We are back down to our normal grand jury numbers, indictment numbers. Lately, the past 2 months, we had about a 4-month period where we were almost double what we were used to. So that's a welcome relief. I know the sheriff is going to talk about this in a lot more detail, but we have an task force we've been working with closely with the sheriff's office, SPCA. And there is a new procedure that we were made aware of. And our office is going to make an attempt to now, there's a hearing that we can conduct at arraignment for animal abuse cases where we can force the seizure of these abused animals from the current owners, which would be a great thing. So we are working with our DA counterparts and other jurisdictions, getting the proper motions and forms for that. And we're going to be implementing that soon. So we expect to get that up and running in the next couple of weeks. And lastly, I believe I have one resolution. It's simply to accept the funding from the Office of Victim Services for our victim witness program.
JP4 authorizing the attorney to accept a grant from New York State Office of Victim Services to continue the victim witness program. Can I get a motion? I have a motion and a second. Any discussion on JP4? Hearing none. All in favor? Aye. Any opposed? Approved. Anybody have any questions or anything for the district attorney?
Okay,
Thank you very much.
Appreciate it.
Thank you.
Next up will be 911, Miss Denise Spengler.
Good evening. A couple of things on my report. Actually not on my report. I'm sure many of you have noticed that your Verizon cell phones are not working. That is a nationwide outage that they are working on. I'm one of the lucky ones. Mine's fine. Need to use phone.
What?
Mine's fine.
Oh,
But I know there's probably most of you in here, they're not working. You'll see SOS up in the right-hand corner. So they're working on it. I don't have any resolutions this month, but I will be bringing forth a lot next month.
Yes, you do, got one.
What do I have?
The chairperson signing agreement, upgrade the
Oh, the AIS.
AIS.
I lied. I have one resolution. So this is the AI, well, we'll get into that. Let's go over my update first.
Yes.
So staffing, we have 3 trainings still going through the call taking, training. You know, still a lot to be determined because it's very early on. We started another training class on Monday. So we've got 2 more going through a training class. That will leave us with 2 vacancies, 1 dispatcher and 1 supervisor. So next month I may be bringing a resolution to fill one of those, so we can try to get up to full staffing. 1 is already approved to fill. My annual report, I'm working on that. I have it pretty much finalized, but I'm just waiting on the final salary information. And there's still 1 more payroll to be processed with some 2025 hours. So once that is completed, then I'll finalize that and I'll send it out before the public safety meeting next month. And then if you have questions, we can go over that. If there's anything you'd like to see in that, you know, once I send it, let me know and I can provide you with the information.
Sorry, what are you sending?
An annual report. So it gives you kind of an overview of, you know, what happened last year. Gives you kind of a
Number of calls, those kind of things?
all of that. Yep. It'll give you some staffing information as far as what was budgeted, what we spent, overtime, you know, where we were over. It looks at all of the emergency communication system expenses. So you can kind of get a high level overview of what's spent on that, you know, annually. And you know what we did as far as training. Let's see what else is in there. There's just kind of gives you really, like I said, a high level overview of everything that went on in the center last year. Backup center, we just contracted with Beardsley Design for the architectural and design portion of the project. So once they are completed with that part of the project, we can start moving forward with the electrical work and then the movement of all of the equipment. We do have the quotes from Motorola, from Intrado, from Eventide to get all that equipment out of the backup center over to our fire. But we've got to get the electrical work and the furniture in there first. So we have a meeting Friday and then we'll probably have a couple more before February. So I'll be able to give a little bit broader overview next month of where we're at. And we should start seeing some progress there. One other highlight, we did have one of our dispatchers delivered a baby using our emergency medical dispatch back December 16th, I think it was. So there'll be a newspaper article coming out soon on that. Those are super exciting because we take a lot of maternity calls, but we don't see through the whole process quite often. So that was pretty neat. I think that was our second one in 2025. So that will be coming out soon. And once that article comes out, I'll send it out to everybody just to highlight that. The one resolution I have is for the AIS. This is basically the interface between the radio system and the recorder. This is the year for our radio refresh. That's a biannual, kind of a big refresh of the core, which is the master site in Onondaga. Part of that upgrade is the requirement of an upgrade to the AIS, which is like I said, that interface. So that's going for approval this month, and that is budgeted.
Yes, the quoted amount is $17,269.90 for the lighting upgrade costs.
You got it.
So, with that, I need a motion to approve.
Move it.
Second. I have a motion and a second. Any discussion on JP1? Hearing none, all in favor?
Aye.
Opposed? Carried. Thank you. Anybody have any questions for the 911 supervisor? Thank you very much. Next up, sign council, Mr. Lloyd Hoskin. Oh, handouts. Wow.
Just, you've already seen them.
Yeah. Buddy.
Eat your pretzels.
Okay, I'll try. There's well of pretzels, thank you.
Good evening or good afternoon. You all received my report. Must have gone out in the minutes. If there's any questions or concerns. What I just passed out was a year summary of the caseloads. And again, I know I'm just putting it in front of you now, and this will be included in an annual report in February. But some of the highlights are that we incurred $3.2 million in expenditures for the City Council program for 2025, of which about 50% was reimbursed back to us. 1.6 million was reimbursed back to us by indigent legal services. Family court was the largest cost driver, rising nearly 275,000 over 2024. It reflects child welfare, abuse and neglect, family offensive matters that are highly time intensive and require frequent court appearances. County court, on the other hand, the expenditures declined in 2024. You'll see on the chart, Auburn City Court, the numbers in Town and Village Court, the Appellate Court, Drug Court, and the parole appeals, which each year go down because we're handling those internally in the office now that we have a supervising attorney. The second page of the handout is where every penny of that 3.2 million went to separated into all the attorneys as well as the expert services, and then further divided into and spread across what court it was applied to. Some very detailed information on where our taxpayers' money went to.
Mark, can I ask him a question?
Yes, ma'am. Yeah.
The issue with family court, that had changed. I mean, I'm trying to remember, was there always county obligation to pay for family court cases?
Correct.
There always was.
Yes.
But then there was an enhanced rate for very difficult family court cases. I mean, I do remember something about family court that,
We have in our new family court grant that will be effective in 2026, we put in for neglect cases that went over a threshold, a certain dollar amount that we would get reimbursed by.
knowing they were high ticket item cases,
Correct.
you mean,
And those are the most expensive, are the neglect cases,
where there's going to be a,
where the county goes in and removes children.
Mhm.
And so we sought after and we got approved on a grant. I haven't heard the status of it, but it's supposed to be in effect in 2026.
and the 3.2 million is similar to last year, or that's higher in general dollar amounts?
That's higher, by, I think last year was 1.3 million,
Oh,
or
that's,
excuse me, I think it was 2.9 million,
Okay.
someplace in there. So it did go up,
all right.
but not necessarily because of the caseload.
Mhm.
We're up, only a handful over last year of the caseload. It has more to do with the difficult cases. And I think when I came in November to request money to cover December bills, we talked about the difficulty of these clients, of many of the clients, and the more time being put into the cases.
And there was a backlog too.
Yes.
And that's catching up now?
We're pretty current on our payments, so.
No, backlog of the court hearing these cases, right?
Right.
That way the third judge came, is that?
Part of the reason, yeah.
Okay. All right, sorry.
And again, I apologize. I sent this to the chairman, and I thought I would give it out at tonight's committee meeting and then follow it up next month with a little bit more comprehensive report.
Can I ask a question?
Yes, ma'am.
You said last time sometimes they fire or term the arrangement with their attorney and then they get another one.
If you're unhappy with your court assigned attorney, you can go to we will not reassign it, but you can go to the judge. And if you talk the judge into, the reason why, the judge will authorize us to reassign the attorney.
And then it kind of starts over. So do you have any sense of how many people duplicate?
Oh, there's probably less than 25.
Oh, okay.
Unless we have an attorney that resigns or an attorney that passes away, we have to reassign all their cases, but we generally will not reassign an attorney.
Thank you.
Are all these attorneys within Cayuga County?
They're all members of the Cayuga County Bar Association, but some of them have offices outside the county or reside outside the county. During COVID, we were desperate for attorneys. We couldn't find attorneys. So we kind of opened it up and we went outside the county. But most of them are Cayuga County, but they're all members of the Cayuga County Bar Association. That's one of the requirements.
And there's still some due diligence about qualifying.
Oh, yeah, they have to, they go through an interview. They have to show that they've been admitted to practice law in New York State.
Oh, no, I
I'm
meant
sorry.
the clients that are getting the assigned counsel in
Oh.
terms of financially qualifying.
Every one of them fills out a financial aid form. And although the presumption is if you fill it out, you're going to qualify, we do review everyone.
It is based on self-reporting though.
Yes, it
that's-
is.
So it's tough
Yes.
for anybody to,
Yeah,
Yep,
because you really can't require pay stubs and all of those things.
not
they wouldn't even
anymore.
make them affirm anymore, I don't think.
Correct. And that was instituted by New York State.
Right.
Okay, does anybody else have anything for Mr. Allen? Not, Lloyd, we'll get right into your resolutions. I'll start out, JP2, appointing the administrator, indigent dependents of time and setting the rate for compensation. That person would be Mr. Hoskins. He is, kept his, compensation rate at the same as it was last year. And he's asking for a 1-year appointment. So I will ask for a motion to approve.
Move it.
Sorry.
Second,
Second,
any discussion?
your choice.
Hearing none, all in favor?
Hi.
Any opposed? Approved.
Thank you.
Welcome for another year of insanity.
Thank you.
You sure?
You have another one, JP3, authorizing the chair of the legislator to lease office space at the office of assigned counsel. And that is a new place, I assume.
We had moved there over a year ago, and we talked about this back in October, about going with a 2-year lease, and the pros and cons of it. And for some reason, we all thought had gone through the legislature, but it did go through committee. We talked about it, but it never was approved by the full legislature.
Yeah, so for a 1-year,
This is a 2-year.
this one, my resolution says 2. Is that a typo?
A 2-year mark?
No, mine says 1 year on my resolution.
Additional year, is that what their confusion is, or you wanted it to 2 from now?
It goes from November of 25 to October of 27, correct, Fred?
Are we talking about the appointment?
No, JP3.
The lease.
JP three. It goes till the October of 27.
And
In the resolve,
Must be a typo up on top because it says.
the first whereas says 1 year.
we will correct that. I assume there's a friendly amendment.
As a friendly amendment, I don't have a problem with it. Does anybody else in the committee have a problem with it?
Excuse me, that resolution 357-24 was for a 1 year. That was the original resolution. And this is extending that resolution another 2 years.
That's correct. I reread it when Mr. Hoskins was talking. The first whereas is referring to a one-year resolution.
That was the very first resolution back when we got thrown out of the courthouse.
Yeah, it's like whereas from the bottom defines 2 years.
Okay, now I see where it's at.
Yep.
Okay, so it is a 2-year lease.
With no increase in the second year.
Correct, for $2,505.
That's correct. And this is all per month and it's all reimbursed by New York State.
Okay. I need a motion for the JP3.
Move it.
Second,
Second.
any discussion on JP3? Everybody happy with the way it's worded and correct?
Yes.
All right. All in favor?
Aye.
Any opposed? Approved. Anybody else have anything else from Mr. Hoskins while he's here? Thank you, Lloyd. Appreciate it.
Thank you.
Another year.
Yeah. Next up, would be the coroner, Dr. Duckett, and I don't see him here and I don't see him on the computer. Emergency Services, Mr. Srvs.
All right, good evening, everyone. I did not complete a formal report this evening, but I'll just give you a couple of notable highlights, just since our last meeting in December. At that point, I reported we were covering right around 141 calls a year that the office was dispatched to. When we finally complete last year's tally, we're going to be somewhere in the neighborhood of 155 or so. We had a couple of significant water rescue incidents that occurred, one on Owasco, one on Cayuga Lake, and then a few structure fire calls that occurred throughout, notably one with injuries in the town of Bacon. Similarly, we've also been busy. We were working cooperatively with the health department. The village of Cato lost water last Friday, which you are all aware of. And as of what time today, Deanna, that boil water order was lifted?
This afternoon.
This afternoon. All of that in consideration, I only have one resolution this evening, and that is authorizing the adoption of the amended Cayuga County Fire Mutual Aid Plan. The mutual aid plan is something that's required by the New York State Office of Fire Protection and Control to be adopted or revised every 5 years. There has been a 160-page plan that was circulated. We do have to do just a couple of clerical edits, such as changing some highlighting of words for comments and a couple of phone numbers. But other than that, a clean version will be distributed before the final legislature. If you haven't read the entire 160-page document, about 60 pages of that is the Auburn Fire Department hazmat plan, given they are our county hazmat team and are part of the Tri-County Consortium with Cortland and Tompkins County. Ultimately, though, behind me, for those of you who don't know him, is Mr. Dave Perkins. He's my fire coordinator that came on board June of last year. And I'm very pleased with this document. We've spent an awful lot of months reviewing it and going through it with the Fire Advisory Board. And ultimately, it passed unanimously at our December meeting before we curtailed for the holiday season. And with that, I'll entertain any questions or commentary that you might have.
Hearing none, Riley, we'll just get to your resolution. JP5, authorizing the Cayuga County legislature to adopt the amended Cayuga County Fire Mutual Aid Plan. I need a motion.
Move it.
Second.
Second.
Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Approved. Very good. Thank you, sir.
Thank you much, folks.
Next up, probation, Tyrone Thomas.
Hello, everyone. Just in my report, I just have the updated numbers for 25. And just next month, I'll probably hopefully be coming back with, we're looking at trying to do something with electronic home monitoring. Possibly found another vendor that will take us from, like, I think we're paying $9 a day now to like $3 or $4, somewhere around that range. So hopefully we'll have that. It's, it's a little more work what we have to do on our end, but definitely doable. So I don't see any real benefit of paying $9 at this juncture. So So we'll be looking at that. Other than that, I don't have much. I have one resolution.
One resolution, yes. If you want, we can get right to it. JP6 is authorizing the chairperson of the legislature to execute an agreement between the Cayuga County Probation Department and IPPCT Technologies, Inc. for monitoring services for sex offenders.
So basically, what this is we have a requirement to monitor computers and phones, but we just haven't had any real mechanism to do this. It's something we've been working on for a couple of years, just trying to figure out where and how we would be able to do this. But finally got this, and it's been working in other counties, so they're happy with the service. So this will at least get us in compliance with monitoring this population.
Move that.
I have a motion. I need a second.
Second.
Any discussion on JP6? Hearing none, all in favor?
Aye.
Any opposed? Approved. Anybody have anything for Tyrone? Thank you, sir. Have a great night. Next up, Sheriff.
Good afternoon. With my report, I don't have anything to add in reference to that.
We have one resolution, sir.
One resolution, and then I did have one other item if I could bring that up after.
Sure. We'll start with your resolution, JP7, authorizing the Cayuga County Sheriff and the Chairman of the Cayuga County Legislature to renew a contract with Galls LLC to supply uniforms for the Cayuga County Custody and Parole Division. I need a motion. I'll second it. Any discussion on JP7? Hearing none, all in favor?
Aye.
Any opposed? Carried. Floor is yours, sir.
Thank you. The other item that I have, Nicola Parisi, the Executive Director with the SPCA, had come in July and expressed some challenges they were having with the cost of holding live evidence in animal cruelty cases. This has kind of popped up again with a significant case that we helped them with back in December, mid-December. There were a number of animals that were taken. They're still there at the SPCA. They have to be held on to while the case is being adjudicated, but it comes with some significant costs and some challenges for the SPCA. And I would really like to urge the legislature to look at working with the SPCA to try to get them some funding to deal with these situations. It's not something they're required to do. In a lot of counties, sheriff's offices and the state police, they don't have the benefit of having an animal cruelty investigator out there doing this work or an SPCA to house the animals. They actually have staff that are actually doing that work. And so it's a great benefit for us to have them right here, to have a cruelty investigator doing this work. And it's significant cost savings. Right now, we're not, helping them with anything, but there could come a point where, SPCA just isn't able to help us address some of these cases. And we're going to be saddled with trying to determine where do we take these animals when we seize them. So he did, I know he sent an email to the legislature, all of you. I'm just asking if any of you would like to come tour and learn a little bit more about this particular case and see what they're doing and some of the challenges they have. So, I would urge you to try to do that if you can, but at least consider trying to work with them so that we don't get into a situation where we don't have them as a resource. And it would certainly cost us more money down the road if we didn't have this service. So that was the other thing. I did tell Nick that I would bring that today. So I think he wants to try to circle back and have some additional conversations about that challenge.
Is there a specific time or date for the tour, or?
I think in the email, he just expressed to reach out to him to set something up.
Okay. So, if you would pass along from, me as the chairperson of the JPS that he would like to come and speak, it's pretty much an open invitation.
I will do that. I can link him up with you if you want me to do that too.
Yeah.
Okay. Thank you.
Remind me in the email, did he give a target amount he's seeking?
He didn't.
I didn't think so.
No.
I know that there's multiple animals, multiple species of animals in this particular case. Right.
Yes, there is. And he did point out there are a number of counties that have contracts with their local SPCAs. He did provide a contract from Schuyler County with me, but I don't think it's a significant
I
amount
remember
of
him
money.
saying 25,000. Didn't he ask a year ago or?
I can't remember what he
Yeah.
asked for that day. But yeah, looking at, if we had to staff somebody to take care of these cases or try to figure out where to put animals, that would be significantly more. But I will link them up to you, Mr. Chair.
Sure.
Thank you.
Thank you. Anybody have anything? Oh, we did your.
All set.
All set. Okay. Oh, anybody have anything for the sheriff? Not? Thank you, sir.
Thank you.
Good evening. Next up, stop DWI, Miss Deb Dennis. Deborah, I should say.
That's fine. Happy New Year, everyone. Just have a quick report, just to run a couple of things. Back in the late fall, school districts in the area applied for grants to have certain DWI programs at their school. And I'm happy to say that Leedsport Central School was selected for an Arrive Live tour that will be coming to the school at a date to be determined. At that time, we will be able to present and and have a table there. So I'm really happy that the school district applied and was able to get that presentation to come to their high school. They were one out of 13 schools in the state that received this training. I've met with Finger Lakes local media to do some work going forward with promotions for Stop DWI. And this year we're looking at some digital marketing as well, something we haven't tried in the past. And I will also be meeting with the Double very soon to choose our sponsorship for next year. Typically, we do a night at the Double Days. We're going to look at doing that again this year. That's will be pretty successful and hopefully cross our fingers for a more mild weather evening. So there's some things that are going on there. For next month, I will have a report. I've been working with, I have to do an annual summary to Stop DWI, just with kind of how our county did as far as like number of tickets given, drivers who were ticketed. And it goes down as far as like male, female, ages, things of that nature. Some of the motor vehicle data is still coming in. So I don't have all the specifics, but just to give you one general number as of now, Cayuga County in 2025 is at 174 DWI drivers who've been referred. And that's a combination between the sheriff's department, our local police department, and the state police.
Okay, you have two resolutions for the evening. I'd like to get right into them.
Okay.
JP8, authorizing the disbursement of planned annual appropriations of Cayuga County schools for after-prom events for academic year 2025-26 from the Stop DWI program budget. I need a motion.
What?
Second.
Second.
Any discussion on JP8? Hearing none, all in favor?
Aye.
Any opposed? Approved. JP9, authorizing the legislature to approve of the 2026 Cayuga County Stop DWI plan.
I'll move it.
Second.
Second.
Any discussion on JP9? Hearing none, all in favor?
Aye.
Any opposed? Carried. Anybody have anything for Ms. Dennis on the DWI program? Hearing none, thank you very much.
Thank you.
Does anybody have anything to bring forward to this committee before we adjourn? Hearing none.
Move to adjourn.
Second.
Second.
Approved.
Say.
Thank you.
Now I just do the roll call.
Yep, and you can then ask for approval of the minutes.
Yep. Elaine Daly.
Here.
Eileen McNabb Coleman.
Present.
Ben Vitale's excused. Tom Winslow.
Yeah.
Can I get a motion to approve the minutes from December 3rd?
I'll move it.
Second.
All in favor?
Aye.
Any opposed? Carried. We have a number of appointments to the Community Service Board and the subcommittees. It looks like they're all reappointments, except for John Mack. So we don't need to go through each individual one, right? Review them in the larger meeting.
Yep.
That's correct. There'll be a resolution at the ledge meeting for all these things.
Okay, great. So then we can get started with department updates with Kathleen Cuddy is here. Hi. Welcome back.
Thank you. Glad to be here. My prize is having me walk on 2 feet.
Oh, yeah.
Unassisted.
Oh, yeah. It's good
Pretty
stuff.
cool. Yeah.
Hi, everybody. Hi. Would you like maybe to do resolutions first, and then I've got a few things to talk about?
Sure.
Yeah.
So you have 3, right?
Correct.
HH1 is authorizing the chair of the legislature and public health director to enter into a letter of agreement with Cornell Animal Health Diagnostic Center.
Move it for discussion.
Second.
Any discussion?
I'll explain just a little bit more about this. Some of our counties have rabies specimen preparation performed through an annex of the animal hospital at Cornell University. That is very beneficial for us to have that. They do not, they will not euthanize the animals, but they will prepare them. So that's helpful because truly at this point, we're still looking for people to help domestic animals that are not yet, we don't yet have a contract in place for that. So we're really happy that Cornell is available and it's very reasonable price as well.
So it's it's per specimen, so we only pay what we use them for.
Correct. And the euthanized animal gets there from the person who euthanizes them? Or the firm that? Or that?
We're hoping they're already dead.
Okay, all right. Okay.
But in truth, if it's someone's pet cat or pet dog, it's their responsibility to bring it to their veterinarian. The veterinarian can euthanize it and then people will coordinate in whatever method necessary to transport the animal.
Any more questions?
I'll make a motion for HH1.
We had a motion in a second,
We
right?
already did?
I'm easily screwed up.
Aye.
All in favor?
Aye.
Any opposed? Carried. HH2, authorizing the Cayuga County Legislature to create the public health director to fill a women, infant, and children assist help program position following a resignation. So it's just a straightforward backfill.
It is. We were able to promote someone. It's kind of the domino effect. We were able to promote someone to a position, someone to the position they vacated. Now we have this vacancy, but the calendar year ran out, so we had to bring the resolution in. This is 100% funded.
I'll move it.
Have a second?
I'll second. And this is wait and fill only because of the health program?
Right.
Yes.
It's a health program. Yeah.
Yep.
Any other discussion? All in favor?
Aye.
Any opposed? Carried. And then the third one is authorizing the chairman of the legislature and public health director to enter into a contract with New York State Department of Health and accept 100% of these funds.
Right. So children and youth with special health care needs, there's a good amount of money that the state asks us to do some outreach and some special programs for families with children who may have special needs. So for example, we do some work with Play Space, for example, and they may get in music therapy and things like that. So this is accepting funding to help. It also helps offset some salary of our staff.
I'll move that.
Second.
Any other discussion? I just had one question. So it looks like the year one is 93,000 and then it's down from there. So is there some extra cost in the first year? Is that just the best way to divide it?
There's a fairly wide open work plan. They had extra money this year. And so we're actually going to be working with, our intent is to work with our Joe Muchak.
Injury prevention.
Injury prevention, thank you. And do maybe some special programming at public parks that can be more sustainable.
Targeting kids with special health care needs?
Correct.
Yeah.
So if there might be modified equipment that could be useful, perhaps we are able to do that.
Okay, thank you.
Awesome.
All in favor?
Aye.
Any opposed? Carried. Thank you.
Thank you. Would you like me to go through my?
Yes, please.
I have a number of things I'm going to talk about. I know it can be long sometimes for people, but it's so interesting. There's a couple of things. This is pretty straightforward. We are applying for a grant that's included there. The form that we are asked to fill out. If anyone needs it. Actually, yep. This is Leading in Lead round 2. Leading in Lead is round 3, excuse me. It is the program in which rental units are able to replace some of their windows and doors. It is a process. The state agency that funds this, which is the Homes and Community Renewal Office, has asked us to apply. So we're applying. We hope to get this funding. We're really still getting this program off the ground with some of our year one funds. So we'll do our
The
best.
year one funds are the ones that were responsible for the hiring of the 3 additional staff in the department, or no, that's
Different.
all different.
This
Okay.
is really for property owners who
Okay.
have units that they want to get ahead of the game before the rental registry is what you're thinking about.
Mhm.
And want to, if they're identified with lead hazards in some of their primary friction areas, they may need some assistance to pay for the cost of replacing some of the windows. And this is an opportunity to get some assistance.
And you'll pass the money through to these landlords?
We pass it through to Homesite.
And they're going to be,
Homesite
okay.
facilitates it with,
Yep.
with the property owners. There was a process. You have to go through an application, but it's very doable. And there's at least one application that's pending with the Historic Preservation Area office at the state for final approval. And we hope will pass so that we can get this underway very
And then the
shortly.
burden of the program is on home site, not,
So they'll do
and you
the-
get
the contract and
Yep.
stuff. We have to go back in though and make sure that, yes, is it lead safe? Yes, was the work
Yep.
done according? Yep. So there's an element of work on our end,
Yep.
but the hard part is the construction and
but because of the community of need, Auburn, New York, that's why all this money is getting targeted here, because they know they have so much lead need for
in the
abatement.
13021.
Yes, okay.
Yes, correct.
Question. Rental units, only rental units?
For this pot of money, yes, not for homeowners.
Okay.
Yeah.
Thank you.
But for landlords of people who rent? You say homeowner, not for individual, single
You,
homes?
you have to be the landlord
Yes, got
to
it.
apply.
And you have to have rental property.
Yes. 2 or more units in one building.
Okay.
Passing around a great handout. I know, and I am remiss in not saying during my absence, my appreciation for Deanna and the work she did in the report and keeping me informed on what I needed to be informed of, but still letting me recuperate. And I know she started some really great things with people's program summaries. And this is another great one to talk about. Our WIC runs on a fiscal year, so October 1 through September 30. This is a really great summary. It really shows how WIC recipients are throughout our county, and we're really pleased about that. We serve an average of 1,388 people a month. The grant offsets obviously all our operating costs, which is staff and rent and phone service, et cetera. But it also offsets a significant portion, nearly 65% of retiree costs, which we're glad for. But as importantly, WIC is good for the community as far as vendors, right? The over $1 million in WIC benefits were redeemed in local grocery stores. And then you see some of the community collaborations that our organization does and some of the outreach efforts. It's a really wonderful summary of what the WIC program is and who we serve within our community. Another important document, I'll show you this, but then you'll get an email from me with a link to this. If anyone would like a hard copy, I'm more than happy to get you a hard copy. And I'm going to share this also with department heads because there's a lot of useful information in this. This is our 2025 Community Health Assessment. Megan McCole, our senior public health educator, did the bulk of the work in this area, but it was a months-long process because we surveyed. Remember us coming here and asking you to answer surveys. Mm-hmm. We had really great survey response from throughout the county, so we were truly pleased. This is a required document. We put it used to be every 3 years. From this point onward, it will be every 6 years for local health departments. We have to complete a community health assessment, and based on the community health assessment, then we create a community health improvement plan. That plan incorporates a lot of prevention aspects, a lot of our state aid work. Right? But there's a few highlights that I think are really useful. There's a lot of good data in here. It's some wonderful analysis. It's a lot of feedback from the community also, but I'm just going to hit a few things that I think are jumped out, and Megan really helped put some of these notes together. The results regarding the mental health questions were very notable. Half of the individuals who responded to the survey, and we had nearly 800 people who responded to the survey. It's specifically, yes, 795 people, and 18 or older, and you had to reside in Cayuga County. Half the individuals rated that their mental health was lower than good. 70% of the survey respondents stated that mental health within the community was one of their primary concerns. About how do people get health care, a lack of providers, and primary care and specialty care was an area of concern. This is 29 primary care physicians per 100,000 people in the population is the data we have for Cayuga County, right? It's lower than most of our other counties. So for example, Onondaga, which you might expect because they have hospitals and specialty groups, is 92 per 100,000. Oswego has 40 per 100,000. Portland, 37 per 100,000. Tompkins, 80 per 100,000. So that's tough. Our primary care offices are swamped, right? There are apparently 3 dental facilities that accept Medicaid in our county and only 1 OB office in our county. In Cayuga County, this is not, we're not happy about this, but it's what the data is telling us and what is being shared from New York State Department of Health with us. Cayuga County does not meet the New York State prevention goals. We have less than 5% of adults from, the goal is less than 5% of adults being uninsured, adults meaning 18 to 64. Right now, we have 6.9% in Cayuga County of uninsured individuals who are adults. If you are non-white, you are more than twice as likely to be uninsured compared to people who identified themselves as white respondents. And another really important thing, we talked about WIC, food insecurity, a big issue. 20% of Cayuga County residents are food insecure, and that's one of the highest rates across all of New York State. That means they're worried about, it's not I'm hungry, it's I'm worried I will not have food to feed myself and my family. And half the respondents stated that they have difficulty with access to affordable food. I think another point that's very interesting is some of the educational things. And I know that a lot's being done in schools. I was a friend was telling me about some videos that Genesee Elementary does that talks about how they celebrate attendance at school, which is really good because high absenteeism in grades K through 8, there are about 26% of the students miss more than 10% of the school days of the year. And this is even higher amongst economically disadvantaged students. So it's not great news, some of what I'm sharing here, but it's, you know, a reflection of our community. We'll find some of the good things, you know, we'll try to, but this was really analyzing both the survey as well as data that the state gave us. So our health improvement plan is going to look at many of these things, but a lot of this is information that can be utilized by some of our partner agencies because they may be services that we don't provide directly. So this is up on our health department website. You go to the main page, there's squares and it's the first button on our health department page. So if you go to cayugacounty.gov/health.
Is there any place to compare it to previous years? Do we know how it's changed?
We do have some data from previous years from some of this. We did change the survey this year compared to the last time we did this. So it's not exactly the same, but we do have state data from year to year that we certainly
About our county.
About our county state. Yep. So you'll see that. I think you saw on the agenda today, there was a small graph that Dr. Archer, our Community Health Services Director, put together reflecting flu cases in our county. It is, as it is across the nation, as it is in our state, there's a rise of flu in our community. You can see these were numbers that took us into December. Riley spoke about the Village of Cato water issues that happened. So appreciation to our staff that were working on that with our public information and our environmental health staff. Worked with that. That was Friday afternoon. There was a water break Saturday, early hours of Saturday. Areas of the village were without water. And the village was able to repair things on Saturday. And so today you have to have 2 days of clean water tests. So the laboratories weren't open till Monday. So Monday and Tuesday, samples were sent.
Is Cato under a consent order or do I make that up?
No, the village of Cato is working on a lot of issues regarding their water infrastructure.
And there'll be a mandate to really improve it and fix it?
There already is.
There already is. Okay. And they're in process.
They are compliant with the so some of you might have seen on Channel 5 did a story and the mayor was on there. You know, I think the current elected officials in the village are very cognizant and working toward trying to resolve some of these issues. And they do have a contract with an engineering firm. Martin and I can never pronounce LeJudas. That's how you pronounce it. I never say that correctly. And they have to go after some money because it's going to be expensive. As I understand it, the break that occurred here this past weekend was nearly in the same area as the break that 3 years ago, you know, the day before Thanksgiving, people were without water. It's not perhaps unique to a lot of infrastructure issues, but that's particularly difficult, I think, for the village.
Yep.
Can we go back to this for a second?
Yes.
It seems somewhat contradictory. The applicants must live in New York State, et cetera, be pregnant, blah, blah, blah. And then economic impact. This grant offsets 65% of retirees' health costs. How does that work?
You have to be a resident of New York State. So they only give us so much money. There's so much money that's spent toward their vouchers. They have to be approved for that. So when we pay there's some that's just meant for administrative. So when we pay our staff, if we have some extra money after paying our staff salary and benefits, we can put it toward
you can use some of your
administrative costs.
WIC grant.
Put it to our employees.
To our employees, our Cayuga County employees.
Okay.
Yeah.
Because that's a cost in your budget, retiree health insurance, and WIC covers some of the retired WIC staff up to a certain point.
That's right. We have about 65% of the health insurance for Cayuga County retired employees from the WIC program. And so that's the program stuff I want to talk to you about, but there's one more thing I need to talk with you about, and that is personnel. It's not something we need to go into executive session for. Our Director of Environmental Health resigned to take a new position. Her last day is tomorrow. It's a great opportunity for her, and she's making a significantly higher amount of money in her new role. And she's staying within, the retirement system. She's staying in Cayuga County and she's staying within the retirement system. So this is a huge loss, not just to our department, but to our county, because she was the only professional engineer on staff. A number of years ago, we had, as I recall, we had at least 3 engineers. And for the last decade, we had at least 2 engineers. And now we have none. I don't know if we'll be able to attract somebody who has a professional engineering degree. And that's a real hurt because of the public water, the significant regulations and technical knowledge necessary for public drinking water, for our lake health, for our sanitary code. And it requires, some of this requires just an engineer, right? We had these conversations, for those of you who are on HHS committee, about contracting with an engineer during the employee's leave of absence. And so I will be coming next month with a request to renew contracts with engineers. But we will need to look for, I'm really looking at it 3 ways. So you're going to see, I'm working with HR, and you'll see a variety of resolutions that come through this or this or this, as far as trying to fill positions. We're going to look to try and find somebody who might be our Director of Environmental Health Services, as well as have an engineering profession, a PE. That would be fantastic. That's the ideal. We want that. If we cannot, we're going to look to hire an engineer and also hire a Director of Environmental Health Services. And we need that. There is such breadth of very detailed, very regulated, mandatory services that our Environmental Health Division does.
You were talking part-time engineer though, when we were at the Personnel Committee, and a Director of Environmental
Correct.
Health. So if you can find someone to oversee the department without the engineering degree, you could get potentially a part-time engineer to support the engineering work. Right, that's what you're.
Yep. And if we have no success that, we still need to find a Director of Environmental Health Services, and we'll have to continue to contract out. But one of the I won't call it a problem, our contractors have been very good as far as we're aware, and for the work they've done for us. There's no one to QA their work. So I can look at it and be, yep, that's in compliance with the sanitary code, but I can't look at the design plans and know that that's the case. Our State Department of Health engineers are helping us where necessary. Primarily with municipal water system work is where we're asking their help, because it's just so broad and so important that it's done correctly. It's just a real disappointment is what I can say. You'll see that I'll try to come forward with resolutions. So next month, you'll be like, why are you looking for 3 different things? Well, this is why I'm looking for 3 different things on the same resolution.
But is it true? I guess I thought Diane was going to do anticipated openings at this point in time and not wait till next month.
Yeah,
to see
that's
if there's any interest in any of that combination of things.
We need some salary information on that.
Yep.
And
this is a non-bargaining, they're all non-bargaining. Yep.
Correct.
Because the amount of contracting we'd have to do would cost way more than.
We spent in 5 months about $35,000 in contracts with our engineers.
And that was with having the full-time person.
But they were on leave. They were on leave for those 5 months. So, yeah. And they weren't paid the entire time. They were paid part of the time. But yeah, if we use them, it's a cost. Yeah, so I actually had a conversation with Diane in HR today, and we've revised one of the job descriptions and we're looking at the other one, and we definitely want to start looking ASAP. But again, we just have to all be on the same page about what an appropriate salary is. And so we've done some homework on that also. This county does not currently pay a fair salary for an engineer. So. Any questions for me regarding that or anything else?
Thank
All right,
you.
great.
Good to
Thank
see you.
Thank you.
Lauren Walsh. Yeah, but the resolutions, right?
Want good news or bad news? Oh dear. Want the bad news first? Yeah, might well.
So. Yeah, let's do that first. So I don't know if anybody has been aware of anything as far as the federal funding of grants being cut roughly as of yesterday. So we were awarded a 4-year, $4 million SAMHSA grant, which has been what we've been providing the school districts deep in schools. That includes Moravia, it includes Union Springs, and it includes Cato. We also are doing some DBT work in Weedsford, or we had done a small group there as well. So there's 4 different school districts that we were in. We received an email at 8:00 last night with a notice attached that just is very general, but says your funding is done as of January 13th, which yesterday was January 13th. So there's no warning whatsoever. It's done. And then at 2:00 this morning, we got other emails from SAMHSA just around the closeout process, and we have 120 days to do that.
How many positions are tied to that?
So there's a grant assistant and there's 2 full-time therapist positions. With the idea that they would cover the clinic time as we moved, the therapist into the school district so they could cover the clinic time there. So today's been pretty much kind of brainstorming and around that and how we may be able to continue some of that work and we had a sustainability plan that we were already thinking of. It just needs to be sped up and expedited.
Some of that school-based services?
Yeah, so it was around creating satellites in all of the districts. We have
really unfortunate
2 satellites right now in the 4 districts, 1 pending. Everything's been submitted for Moravia. And then it would be a matter of, we've had discussions with Cato. We notified all the school districts, obviously, today as well. So we want to get together and have meetings with each district to kind of talk about the plan going forward. I do have a meeting with Sreen to kind of talk more about that tomorrow, but I was just kind of joking, but I need like a personnel, hour committee meeting to kind of talk about what this is going to look like. I do have some ideas of how we may sustain some of that work and how we may be able to fund that. But yeah, it's devastating because it is really, really good work. It takes a while to get new programs off the ground. And we were really starting to gain momentum, especially in some of the others, a couple of the districts that we didn't already have a satellite established. We didn't have relationships. So we were able to build those and really get things rolling. So it's pretty frustrating.
Do you have other grants? How vulnerable are you to, because if this was just a round of it?
So this is, it seems as though this is a very specific type of grant that's been
It looked like it was MAT, like it was addiction related ones.
This is the Children Mental Health Initiative kind of part of SAMHSA grants, like the system of care type of work. I know that I know Herkimer, Onondaga, Cortland, we're all notified that there's the same letter. But it seems as though there's over 2,000 grants that have been.
There's 2,800 and $4 billion that were ended in one day.
Yes. Yeah.
Yeah, scary.
With no, that's it, can't spend another dollar.
If you can't set up the school-based satellite clinic, then you don't have funding for these particular staff anymore?
Well, so how we offset that, right? We put 2 full-time positions in the budget.
Yeah.
We hired those two people and then we dispersed the existing therapists that were already in the clinic out to the school. So it sort of like was to cover what was being done in the school. So there's a lot of thought behind what that's gonna, what that's gonna look like and what we're gonna do. So.
That'll be a big hole in revenue that you didn't.
How often
Yeah.
did you draw down funds? Like were you up to date or were?
We, for the most part, but as of January you had to wait for like the budget to sort of roll over. So
Yeah.
we hadn't done one yet, but we did one today. So
Okay, and you were able to?
as we'll see.
Okay.
Is it spend and claim? You have to-
Yeah, I mean, you just,
Yeah. So if you
do a
get
drawdown.
behind, then they can be like, nope.
But it seems as though up until yesterday, we will be able to draw down funds up until then.
Yeah, so this program was created from the grant that got taken away. And positions were filled with the grant money. And was that, I guess explained at the time, the grant went away, so did the positions.
It was.
Yep.
Was.
So you're
But I
gonna try to
do-
be creative to
I
see
do
if you
have
can.
a couple ideas of how to sustain some of that work, even if it is for 1 year, so that way we can have a better sustainability plan when that year ends. Just as far as us being able to be reimbursed for
Like
the time.
state aid or
We will
whatever.
not be able to do all of the work that was in this grant. I think there was a lot of money for, training and technical assistance and like ongoing consultation and there was a huge system of care type of initiative that was also part of this grant, working with New York State Families Together. That part will not be able to continue, but the work in the schools, I would like to maintain and us be able to get reimbursed for the therapist time there. So again, this is like with less than 24 hours of me thinking about this, so I'm really trying to figure out how to make that work.
Pretty much though telling us that you're going to do whatever you can do to try to find funding for these bodies. And if you can't, then
Well, and
you can't, but if you can, you're gonna try.
The other piece is we do have a therapist retiring.
You can, that's what I was wondering if you could
And
just
we
back
do
that.
have a therapist that just put her resignation in. So there are two positions that.
So that leaves you the
At the
grant.
end of March, both positions would be empty as far as
But if
those.
there's attrition throughout your department that they can be absorbed in, then that's all better.
Right. That's,
So just be the grant coordinator that you've got to be
yeah,
creative.
but I
with.
also have an idea about that as well. So, okay.
To be continued?
Yes,
To be
there's like a
continued.
lot of different ideas.
But you realize you're not
Yes.
going to.
I can't, there's no way that we can sustain all of the work in that grant, but that work in the schools is really important. It's doing a lot of prevention work. And obviously that work it's usually not, it's not billable, but it's also really important, especially with where we're at. And if we can prevent some of the mental health or substance use, issues that would come up later in life, if we can do that by initiating some of this in the schools, I think it can go a long, long way. So, to be continued. Like I said, it's just less than 24 hours of my brain going like, as far as what we can do.
You said you had good news too?
Yeah, so the other piece is we are receiving some additional funding for assisted outpatient treatment. I think I briefly talked about that. We really weren't sure what the amount of that was gonna look like. It's pretty significant. So we will be receiving, and I'll bring a resolution next month for the acceptance of those funds. This is gonna be for over $300,000. But each year annually, it will be about $200,000 a year that will be in our state aid letter. This is the state's initiative of really trying to revamp that program, and all counties are going to be responsible for really developing some detailed policy and procedures. And it can pay for staffing. It can pay for the AOT evaluations that the psychiatrist is completing. It can also help reimburse for any court proceedings or costs, Fred, as well, for the AOT process.
Because that's mandated work.
Yeah.
From the.
The LGU is required to.
Whether you ran a clinic or you're not, you would be, the county's mental health would get a referral for the.
Yes.
Yes.
AOT.
Yep, that is correct. It's not to get more AOT referrals.
Mhm.
It is to better manage them and have, outline policy. There's a huge part around outreach to the community, teaching about what AOT is, because I think there's a misconception that this is, makes people take their meds, makes people, it doesn't work like that. I think there's a certain criteria, certain people can really benefit from it, and then there's a population that obviously may not. So it's really around educating the agencies and people in the community about it as well. So there's those two things. But I'll bring a resolution next month for that. Like I said, I'm just gonna meet with Shreen tomorrow morning, kind of like come up with a game plan. More than likely you'd have to sit down probably with a personnel committee and kind of talk through the details of.
AOT money that's coming is new money, unanticipated revenue that you're gonna accept into your budget and put some expense lines. Is that how it's gonna be?
Yes.
Because you didn't know about it at the time of the budget
Yeah, I mean, we
passed.
knew it was kind of coming. We really didn't have any idea what kind of amount we were talking about. I think the goal was they wanted each county to be able to have one AOT coordinator and be able to pay for their salaries. That's why the money was so significant.
You're gonna have to hire for that?
No.
No.
I think it would be some moving of
Current
things
staff.
around. That's why I said I need a full
Yeah.
hour at the personnel committee meeting.
okay.
So, yeah. But that's the updates I have now. We did fill both of our health home care manager positions really at the same time. We actually had someone who left that decided to come back. So that's a good sign as well, yes. We're happy that she came back, so.
All right.
That's what I got.
Thanks, Lauren.
Yep, no problem.
You. Christine?
I have John from up to the same president. Resolutions, a lot of stuff.
Yeah, do we want to do the resolutions first?
Do you mind if I talk a little bit first?
I don't mind at all. What some of
What I'm gonna talk about kind of ties in with resolutions.
Thank you.
I think there's enough for everyone.
Thanks.
So I wanted to start off the year with a little kind of snapshot of some of the services. Over areas, some of the statistics, so you can kind of get a sense of how we ended up last year. I talked a lot when we were talking about the budget about child protective services, adult protective, foster care, as far as the numbers of cases we have. So this is really a wrap up of 2025 to we can kind of illustrate over time that we've been dealing with as far as those particular program areas. So at the top of the first page is child protective services trends. You can see that I mapped out 2022 to 2025, the total number of reports that were investigated by our child protective services unit here in Cayuga County. And you can see that we've gone down to low of 889 in 2025. So we're heading in the right direction. I think some of the reason that that's been happening is that the state has really taken on an initiative to help mandated reporters understand that supportive services are a good thing to be offering families, and you don't necessarily have to call them in to the state central register to be investigated by child protective services if they don't rise to a certain level. So I think that that's panning out with the decrease over time. You can also see on this chart that we have had a very significant decrease in the number of abuse or maltreatment petitions that have been filed by the department. We started out at 40 in 2022, 29 in 23, 34 in 24, and very low number in 2025 of 15. So that is very, very good news. To be able to have only 15 petitions have to go before family court for
Potential removal or.
considerations. Yep, is I don't know if we've ever been that low. I didn't go back further than that, but I would guess that that's a low. So very, very good news. And I think that this ties into services that we're offering families in the community. We have a lot of resolutions on for community-based, home-based services. And without those services, I think that we would not be able to see this low number. I mean, service provision to families that are struggling is critical in helping them address the issues that, can lead to abuse or maltreatment that rises to the level of the department's intervention.
I did say at the bottom of that box that on January 6, 2026, there were 177 reports that were open for investigation by CPS. So that's just to give you an idea of like what we're talking about at any one day. That's fluid, it changes, but that was what on that day we had as far as open reports for our child protective unit. That's high. We do have caseworkers with high numbers right now. We have a number of vacancies that's contributing to that.
Is there a time frame for get in and get out? No, keep them open for.
Child protective cases? Yeah, I mean, the window for an investigation is supposed to be 60 days. We do have a number of cases that are over that and, you know, that is, you know, we're trying our best to get everything that we need to be able to wrap up that investigation. We were doing very, very well when our numbers of employees in the unit was higher. You still have to get all of the information gathered in order to make a thorough assessment to indicate a case or not. And so just because you're at 60 days goes out if you haven't been able to gather all that information. So that leads to cases running over the deadline while they're gathering that information and trying to make that assessment as thorough as they need to by the mandates. Adult Protective Services case trend, we did 22 to 25 as well. These numbers are kind of interesting. You see that in 2022, we had a lower number, 152, went up into 273 in 23, down to 199 in 24, and then up in 2025.
That's a huge increase.
Yeah, it's a huge increase. I think when we looked at our numbers for 2024, was it, Jen? We saw that there were 4 months.
So, yeah, some of that is indication of when we were displaced. So the county office building closed at the end of May. So June, July, August, we didn't have capacity to put things into the system because we were still getting people computers and that kind of thing. So that's probably why there was a significant decrease
in those months.
But even if you added those, like what we would have saw from the year before, it's still incredibly high for 2025.
We wouldn't have been at 340. We would have been probably closer to the 273. So we are seeing a lot of referrals from the community for adult protective services referrals. There's just a growing, you know, population of folks that are, you know, aging and don't have a lot of support and have a lot of needs.
And the rep pay is no longer available. Does that impact that?
Yep, that can impact that number. Yep. If there's not a community service provider that's doing rep pay work, then the department is always, you know, has to step in if that's
Leave the case
required.
open as a representative pay.
Yep. Yep. So that could be some of it. So right now, we have in January, we had 64 cases are open for ongoing services and 34 cases that were in assessment. Assessment phase means the referrals come in and we have a certain period of time to, like child protective, gather enough information to see if we have to open it for an ongoing longer term case. A lot of work done in those assessments to help link folks up to services, explore family resources, because maybe we don't have to stay involved if we can get them stabilized and get the supports that they need. If we are not able to do that or they need other ongoing services, we have to open the case and stay in there more long term while that, you know, for an undetermined amount of time depends. So that's kind of what's going on in adult protective. Their cases are also high, again, because we have a large number of vacancies of caseworkers right now. Foster care, I was going to write something up myself, but then I found this sheet that I had used in one of my budget presentation slides, and this is even better than anything I could do. So I just put it in here. This came right off of the data warehouse system that's through the state, and it's the foster care in-care detail report as of today. It talks about the number of children in foster care over time. You can see that the very top box on the left-hand side of your paper says in foster care. December of 23, there were 99 children. December of 24, there were 115, and December of 25, there were 80. So you can see that we're continuing to do pretty well with a lower number of children coming into foster care, and that relates to not filing petitions. So we're discharging children from foster care when they're ready to go home for feeding permanency through perhaps, an adoption. And those children are no longer considered in foster care. So kids are going out and we're not bringing them in at the same rate as they're leaving. You can also see on this chart on the left, a breakdown of where the children that are in foster care are placed. So foster boarding homes are foster homes. You can see that we have about 46 children in a foster boarding home right now. Relative homes that are approved and certified as foster homes are 23. And we have 7 in institutions.
What's this one, right?
The graph?
That's what color is that? That's the approved relative?
Approved relatives,
Okay.
yep. That's based on the percentage of the
Yep.
kids you have, so. Our institution, old placement, I mean, that's good. If 7 placements is good. We've been running around 12, and those are the ones that I talked about are incredibly expensive, and trying to do everything we can to try to keep a child at a lower level of care or move them from an institution into a lower level of care is something that we want to look at for child, for the best interest of the child, but it also ends up being a reduction in cost to the department. And then the last page is just a little graph that kind of shows you, again, the 25-month trend of foster care. The number ends, you can see we're coming down in 2025. So I think this is good. We'll keep monitoring this. I can keep pulling this up and see where we are as the year goes on. But it's good. The other small print, a lot of pages here. I think there's like 6 pages. I wanted to give you this, and I know you put this now, but it does give some more comprehensive information about the preventive services contracts that we have with Cayuga centers.
All on this agenda tonight, right?
Yes, all on this agenda tonight. So as we go through the resolutions, if there's questions about them, we can kind of refer to this, but I mapped this out to sort of give you a brief summary of the service, what it's for, the kind of children that are referred to the programs, and how many full-time employees are providing that service under each one of those contracts, so that would make a little bit more sense. We didn't map that out in the resolution, and we had somewhat of a conversation about that. Like, does that make sense? It's a lot of information. But I thought it would be nice to just give it to you in this format to refer to, or, that I can refer to as we talk. But just a couple of other things as far as updates, on the emergency housing front. I had been able to say for months that we were doing really well and our numbers were low. Not able to say that now. We are in code blue and have been providing emergency order housing for individuals and families since the end of October. Our numbers are high. We have about 137 singles right now that are being housed by DSS and 25 families. So considerably up from the 80 something that I was able to say for singles months ago. We just met with our homeless coordinator today, and just anecdotally, she didn't bring the data. We were just having a conversation about something else, and this came up. She said that the number of emergency order housed folks right now is higher than she's seen, way higher. About 20 a day are emergency order housed individuals.
Some of the code blue gets reimbursed, though. You have 100% pot of money that covers some of the code blue.
Yep, you do.
And it tends to cover, it was what, 95, I don't know what, 100,000?
It covers the housing for the individuals.
Right.
It's administrative of-
And then the administrative costs.
Yeah, the administrative costs as well.
Your staff
Yes.
time. Oh, yes,
Yes.
yes, but the actual amount, hotel paying, those kind of things, there is some 100% money that offsets some of the
Yes.
code blue. I mean, certainly it's a huge expense, the whole population is, but there is some.
Yes.
Now, when you, Elaine, when you talk about the 100% covering some of the cost of the code blue, is that code blue only? Is everybody considered code blue at this time of year?
No.
Okay, that's.
No.
I was sure.
If an individual comes in and applies for assistance, they're determined to be, whatever their category of eligibility is. They may be a safety net individual, that qualifies under safety net and, there's a substantial county cost to that. We only receive the 29% reimbursement on that.
Is
If
it
they're
fair?
TANF, if they're under TANF, if it's a family, then that's 100% covered under TANF. Just, it depends on their category of eligibility, but during this season where there's cold weather and there's, we're authorized, we have to house under an emergency order.
But these are just for sanctioned people
deny
under
anybody,
code blue,
yes.
right? They would have normally been denied, but when it's cold, you're going to house them
Right.
and you're gonna use that pot of money for them.
Correct.
Because if it's nice out and you don't follow the rules, you're sanctioned for some reason, you come in and say, I need housing, and they'd say, sorry, you're sanctioned. But when it's really cold out, there's a requirement to house them. And that's a pot of money that could be
Yes.
used.
Yes.
On the federal funding freeze front, I'm sure you've seen, but our, as far as the childcare funds, the temporary assistance families, TANF funds and the social service block grant, I haven't heard nothing more than the temporary restraining order was, put in place and that the funding, they can't. We're waiting for the next steps, but that was the latest news that we got from the Attorney General about the court order preventing them from freezing the 10 billion in funds to the 5 states. Okay. Okay. Any questions on any of that?
Several, but not here.
Yeah.
Not for this committee.
Okay. Any questions on anything else?
Thank you for laying this out. This information, thank you.
You're welcome. Okay.
We'll get into the resolutions. HH4, authorizing the chair of the legislature and commissioner of social services to contract with Chapel House. That's one on Franklin Street.
Yes.
Can I get a motion?
I'll move that.
Second. I have a second.
A second?
Any discussion?
Did we talk about it a little bit?
Yeah, I did have a question. Okay.
So this is the Chapel House Men's Shelter that's on Franklin Street. It's a 15-bed, men's shelter that we've contracted with for, services from Chapel House for a long time. We're talking about a rate per day if we use a bed.
Okay.
So it's $98 per day per person that's placed there by DSS. There's 15 beds that are there. Our utilization of those beds varies. The last I looked on our census, it was 12 beds that were being used by DSS. They also house veterans there. So depending on how many veterans are placed there, our numbers kind of, can go up or down. If they don't have veterans, we can have more.
And it's preferable to house them there as opposed to like a hotel or something.
Oh, yeah, this is our
Yes.
first.
Yeah.
Our first,
So I would imagine they never have empty bed. As soon as the bed's empty,
Right.
but you pull
We place
somebody
there.
out of a
Yep, we
hotel.
place
Okay.
there, yep. And their rate, there was no increase in rate from the 2025 contract.
Okay. Any other questions? All in favor?
Aye.
Hi.
Opposed? Carried. HH5, so authorizing the chair of the legislature and the commissioner of social services to enter into contract with Catholic Charities of the Finger Lakes to provide supervised visitation services for clients referred to them by the Department of Social Service. So that's just one you do every year, right?
Yeah, so we've had this is a contract that we've had for a number of years. This helps us to not have to do this work in-house by our caseworkers who are already, swamped, and we have, struggling with having staff. This helps us immensely to provide the court ordered, visitation that's authorized, that we have to do through our case by order from family court. We are asking for this contract to only be for a period of 6 months.
from January through June, because we would like to enter into the RFP process to solicit, interest for bids. Looking to, if we, get interest, we would, the contract would go from, I1 forward on that. This rate, they do have a little bit of an increase in the rate from last year. It's a 5.9% increase. And they did detail out that the reason for that was because of the rise in the New York State minimum wage. Health insurance expenses have gone up. Their cost for facilities maintenance and admin have gone up as well.
I'll move that.
Second.
Appreciate you guys coming back and asking for the renegotiation of that rate.
Competitive, yeah.
Yes.
You asked how much our spend was for 2025, 50,000.
Mhm.
All in favor?
Aye.
Any opposed? Carried. I'd like to, if I can, because they're the next bundle, the next three, because they're contracts, so HH 6, 7, and 8. So be Chair of the Legislature and Commissioner of Social Services to enter in contract with Cayuga Centers for the Family Preservation Program, Family Support Program, Enhanced Foster Parent Support Program, and MST. HH 7 is to contract with Cayuga Centers for the provision of services for the restorative and diversion case management. And then HH 8 is authorizing to enter into a contract with Cayuga Centers for the provision of 3 respite beds. So are all those carry forward of previous contracts?
Yes. I'll move them for the group and then she can, okay.
Yeah, so we have contracted with Cayuga Centers for these services in the past. There is been no rate increase for the contracts that are in HH 6, which is family preservation, family support, enhanced foster care support, and MST. There has been a 30,000.
Yes,
So
30,000.
About $30,000 increase in the contract amount for the RCM DCM, which is HH 7 from last year's amount. And then on the Cayuga Centers respite bed, that's the same cost as it was in 2025. Question? And just to kind of give you, we took a lot of time today to kind of look at these and kind of break them out and get this information together for you that I passed out. But basically for HH 6, you're talking about $550,000 for programs for the programs that are listed on here. It's 7 full-time clinicians for all of the programs. There's 2 FPP clinicians, 2 family support clinicians, 1 enhanced foster care support clinician, and 2 MST clinicians. They work with a lot of families in the community. They provide a lot of services to kids of all ages, families that, of all different kinds of families in the community. From babies that are being born, where immediately we put services in, all the way up to, your older teens that are struggling and are involved with the juvenile justice system. Prevent a lot of placements. Again, I'll reiterate, I strongly believe that these services that we're talking about help to keep kids from coming into care and helps us with saving money by not having them have to be placed in detention, foster care. Very, I feel useful. Worthwhile. The HH 6, the budget from the Cayuga Centers about these, to provide these services, it actually costs them over $1 million to provide the services, and they bill Medicaid for another over $500,000. They're able to show that they're providing evidence-based services, and they're able to bill through Medicaid to recoup some money that way. So, we're paying $550,000. They're getting $525,000 from Medicaid to offset the cost of providing the services in Cayuga County for Medicaid eligible families, for the Medicaid eligible reimbursement services that they provide.
And, we were talking, we met through the personnel committee, but I'm pretty sure everyone realizes this. These preventive services, as expensive as they are, I mean, there's over $1.5 million of preventive work that you're doing. There is going to be an expectation that they will all eventually go out for RFP, just because you don't, yes. But also there's still 62% reimbursement on all of these preventive services because the state pretty much says, if you invest in preventive care, we will reimburse you 62% of your costs. If you don't, and you go over your foster care block grant, you will pay at 100%. So, I mean, that was your guys' concern about scaling down any of the preventive work, because if it ends up ballooning the foster care population, we'll pay anything over our block grant, and we tend to go over the block grant
Already.
every year.
Yes,
Already.
yes.
But I think there's been a lot of cooperation that, these kind of contracts should all go for RFP. I mean, they should.
Yeah, so our game plan for the purchasing director is to, all of these that we're talking about, HH5, HH6, and the respite beds on HH7, we're talking about getting together with the purchasing director in the summer, in June, to have a game plan for what we need to do to, look to contract for 2027 for all of these, to set out RFPs for 2027 contracts. We're gonna have a meeting next week to get started on the, nitty-gritty of that plan.
So, all in favor of the bundle of HH 6, 7, and 8?
Aye.
Aye. Any opposed? Carried. HH 9, amending the Department of Social Services 2026 budget to accept funds from New York State in the form of Safe Harbor, New York, and to contract with Booker T. Washington Community Center for provision of Safe Harbor, New York services. So this is it's 100% funded.
Yeah, so we received an allocation on Cayuga County for $22,599. Not very much, but it is, we would like to accept those funds so that Booker T, who's done this for the last few years, can continue their work with, they go out to the schools, they, are talking with law enforcement, trying to provide education around, trafficked youth and at-risk youth for sexual exploitation, commercial sexual exploitation. And, just make sure that the awareness is out there. And they also, talk to potential, victims of these things and help, refer them to services and get them hooked up to folks they need to.
So we're accepting the funds. We're not adding any additional costs.
No.
Yep.
I'll move that.
Do I have a second? All in favor?
Aye.
Opposed? Carried. And HH 10 is granting permission to the Commissioner of Social Services to fill vacant positions with the Department of Social Services. That previous authorization expired on 12/31/25.
Sure. So each year we have vacancies at the end of the year. The resolution regarding not having an authorization continue into the next year. We bring forward positions that we still have open and get authorization to fill them for the year of 26. Right now we have 5 caseworker openings, so we're asking for permission to still continue to fill those 5 openings. They are budgeted. We have actually 7, but this one's just asking for 5 right now. We'll bring forward other ones for the other 2.
I'll move it.
Second.
Any other questions? All in favor?
Aye.
Any opposed? Carried. Lots of work. Thank you.
Thank you very much.
Office of Aging. Still figuring out what's going on. So do you want to do resolutions or your update first?
Whatever you prefer.
We can do the resolutions probably, if that works. Okay. HH 11 is authorizing the legislature to create the Director of the Office of Aging to fill one junior accountant help program position. That the grammar makes a difference. Due to it, so you're filling the junior accountant position due to a vacancy. So want to tell us a little bit about it?
Our position, so she has, she has extensive responsibilities for applying for all our funding, claiming all our funding, doing all the required reporting has to be done, as well as our significant part of our annual reporting.
Remind me how long it's been vacant.
This is December 5th.
Okay.
Yeah.
I'll move it.
Second for discussion. There was a lengthy discussion at the Personnel Committee about the possibility of having this junior accountant be hired under finance so that we could start the kind of consolidation of financial work within the Office of Finance. And I think Brenda made some very compelling points that our HR director basically agreed with, that, you know, we should be working out the details of supervision and assignment of work and all of that before this happens. So you will see in this resolution that, you know, certainly you're not, that the expectation is that around October, that this particular position, if all works out, will have a transfer of function and be then reporting under finance, even if they're co-located in the Office for the Aging. But this is a start of trying to do some consolidation in the finance department. Finally.
Is that technically being rolled out with the departments, or?
I think each finance position that could be considered doable, like taking a director of finance from the Department of Social Services may not be as complex as it is, but they're already going to take over the payroll of the Office for the Aging. The finance department is. And at some point, there might be other duties. At some point, the goal would be that in addition to the payroll, that the position itself will then under the appointing authority of the Office of Finance.
I just caution this to be a really careful process with a lot of communication and buy-in with the department heads.
Yep.
And the actual employees is a really difficult thing if they're not ready for it, right?
Yes,
So
and
this is
that's
the first time I've ever heard of it.
Well,
so.
and that's why if there was discussion of doing it in January and it's being postponed until October. So there will be months worth of kind of working out protocols and those kind of things.
So I guess my question would be, how are they going to advertise for this position as far as job qualifications? And, you know, is this going to increase the cost of the salary for this position?
I think it would be advertised as a junior accountant in the Office for the Aging.
Yes. It's the same role, you're just shifting the supervision structure.
Maybe
after 10
in
months.
October, yes.
Okay.
But
Yes, I like the maybe.
Yep.
Because you don't know.
No.
How it's gonna work out.
Nope.
It looks great on paper, but you don't know what's really gonna be.
It's going to be worked out between, I think, Brenda, Finance, and HR.
I'll move this.
I'll second it.
I thought we already did that.
Oh. Okay.
It's double seconded. All in favor?
Aye.
Any opposed? Thank you. Carried. HH 12, authorizing the chair of the county legislature and the director of Office of Aging to enter into a contract for the preparation and printing of a quarterly newsletter to provide information on programs and services for senior citizens.
I move it.
A second.
Something you do every year, right?
So yeah, this was a
Nothing
routine
different.
resolution. We have actually had a newsletter since 1975.
Yeah.
Very valuable.
Appreciate the print. Yeah.
Yes, definitely. And it's part of our requirements to get information out about our services to the public.
All in favor?
Aye.
Aye.
Any opposed? Carried. HH 13, authorizing the chair of the county legislature and the director of the Office of Aging to sign annual contracts with various subcontractors for professional services provided for qualified senior citizens.
I'll move that.
A second.
And again, these are just our routine resolutions, routine contracts that we have every year for food service, meal service, adult day programs, all the different programs that we do.
Were you seeing any changes to those rates from previous?
Yeah, they go up a little bit every year, for the most part, at least in recent years. I mean, the aides are, have a higher minimum wage than the general population, so, and that's been going up every year, so our aid agencies generally will increase their rate to match that increase in the minimum wage.
Actually, I don't know if it's too late, probably could have bundled 14 and 15, or the right, or these 13 and 14, they're the same various contracts. How come we have them separate?
So 13 is the federal fiscal year because we have federal grant funding, and then 14 is the state fiscal year.
Oh, I see, different funding.
Funding.
Okay. Can I back up though? Can I move to bundle 13 and 14?
I'd like to keep them separate. I'm not on the committee, but that would be my
Okay,
request for discussion.
keep them separate.
Thank you.
So back to 13, we moved it, so then I guess. Okay, so all in favor of HH 13?
Aye.
Can I ask a question?
Sure.
Thank you. In regards to these subcontractors, professional services, do we have any checks and balances for these type? Because I know a lot of us have been getting some correspondence in this regard on a few of these.
The lady,
Yeah, you do.
the woman from Fairhaven.
Oh. Yeah, there's a ton of checks and balances on this in terms of verification of time, verification of requirements. Our funding and our New York State Office for the Aging requires a lot of oversight. There's surveys that are set out. Our staff go out and do site visits, go through the agency's records. There is a huge aid shortage, and there has been for the last 10 years, and it just keeps getting worse.
No doubt. And I'm cautious. I want us to be ahead of the curve on this because I don't think this, I don't want to say there's no validity. But I think it would be behoove the Office of the Aging to be on top of this, especially when it comes to services for seniors. There's a lot of innuendos and accusations, unfounded,
There's a
I'm
lot
sure.
of complaints in general about healthcare, and this is.
But I think in that regard, I would caution you to be on our game.
Mhm. I hear what you're saying.
I guess for a point of clarification, you don't use any of the OFA money that you get for individual aides that aren't coming from a licensed agency. You don't recruit people in the community and pay them using any of these funds. If you're going to provide ISEP services or aid services to families in this community, you do it through a licensed agency and through a contract.
Correct. That's correct.
And
And the reason there's so many agencies listed there is because no one agency can meet the demand. And so at any given time, we might be asking multiple agencies if they can help, and we may, or we may not.
And you had gone ahead, I remember from the advisory and had a guaranteed contract with a license, 35 hours a week of aid service. So you could have some discretion on assigning them and you're still doing that.
Yeah, and so, there's two different issues there. In order to utilize our funding and these contracts, the people have to be eligible for the programs. Guidelines. And then the second issue is the aid shortage. So yes, our intent was to have 35 hours a week of aid service, but even that agency cannot aid.
Oh, okay. So, yeah. So the funding for aid services there, the the agencies don't have the human resources to provide.
Right.
But if the concern was that there's private people out there getting Office for the Aging funding or lack of, I don't know what your,
Yeah, I was curious. I didn't know if your complaints about the level of care or
the meals, what.
Well,
You're referring to the one that we all.
it's another resolution, but.
Yes.
But, all of the above, really, the level of care, the level of pay.
And the lack of resources.
Well, the lack of resources, it's a lack of resources, but, even a listing, apparently makes the county look like we're, negligent in the services that we want to follow through on. So.
Again, people have the option of paying privately for care. We've talked about this whole issue of aid service in the community. A lot of people think they should get Medicare aid service. They qualify for a Medicare aid service. Aids don't show up. We have nothing to do with that. We're a non-medical program. We have nothing to do with that. So there's a lot of people who don't understand we're a very small medical program with a set amount of funding with certain requirements. We do everything we can to serve as many people as possible. Again, that's why we have so many agencies. But we have a certain amount of funding. Most of the people in our program get 2 to 4 hours a week because we can't serve them anymore. And we use all of our funding every year to do everything we can for folks. Not everybody's eligible for our program. Some people complain because they need daily care. We don't do daily care. So there's a lot of reasons people might complain that are outside of our control. And it's outside the scope of our program. So.
Because ideally, if someone's on Medicaid, they're not eligible for ISEP.
Correct.
But there's an aid shortage for that population, the home care population and the ISEP population.
Correct. All the way around.
Yep.
Yeah, I mean, I just want us to be.
Yep.
Above reproach and make it clear communication. More than several times perhaps, but.
Are you able to spend your ISEP funds? At one point, you didn't have enough aid, so you weren't, but then I thought that got better.
Yes, we definitely at a point now we're able to do more, partly because of our extra aid program in-house.
Yeah.
Yeah, that's allowed us to be more responsive and get people on quicker and that kind of thing.
Right.
And serve the people in rural areas. Access to Homes contract allowed us to serve people in rural areas. Some people complain that they can't get care in rural areas. That is absolutely 100% true, and it's been true for 20 years.
Yeah.
Our work has been to improve that by contracting with Access with our own aid. And the aid uses our county car and they can get to the county borders. So we are definitely working very hard to serve as many people as possible within the scope of our services. Yep.
Thank you, Madam Chair.
Just to be clear, all in favor of HH 13?
Aye.
Any opposed? Carried. Thank you. And then HH 14, authorizing the chair and the director of Office of Aging to sign annual contracts with various subcontractors for professional services provided for qualified senior citizens. So that are the state ones.
Right, this is state related to very similar services.
I'll move HH 14.
A second.
Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Carried. HH 15 is authorizing the chair of the county legislature and the director of Office of Aging to sign the renewal of contract for meal service for Cayuga County.
I move it.
I'll second.
Discussion.
This was another area where there seems to be complaint. Again, I don't know if it's valid or not, but.
And unfortunately, I obviously can't talk about individual complaints in the meeting. So is there a general kind of concern that you'd like to bring up that I can address?
We've been asked to look at the quality of it, which I know you do. Can you just speak to the process of how you make sure that it's good quality?
So this requires going out for a bid. I believe we only had one vendor respond to the bid. We talked with Monroe County. Monroe County uses the same vendor. They're very, very happy with them. We got to try the food.
Monroe County uses the same one?
Okay. Yep. We got to try food ahead of time. All our staff got to try the food. I've eaten the food ongoing. We have 455 people that happily received the food. So we do surveys twice a year, once a year routinely. Additionally, if there are any concerns or complaints on a particular route, we'll do additional surveys. Our staff are in touch with the individuals at least twice a year, once by phone and once in person. We have volunteers that are delivering every single day that talk to the person and relay to us if there's any concerns. These are nutritionally balanced, meet 1/3 of the daily nutrition requirements.
So the staff interacting with are they getting a significant amount of concerns or people mostly happy with it?
Well, by far, people are mostly happy.
Okay. Helps to put in the, those people don't usually, you don't hear from them, you hear from the people that are concerned.
It's a blind survey that we do. So we welcome people to put in their concerns and complaints, and we'll hear things like, I don't like fish, so I don't want fish. And people have the opportunity to ask for an alternate meal. That's not a problem. I will say when this contract started 2 years ago, it was a brand new vendor to us. And there's always during a transition period, the meals are traveling from Rochester. So it's notorious for the broccoli to get mushy when it's held at temperature for a long period of time. So we've had our nutrition coordinator has had and continues to have continuous contact with the kitchen in Rochester to give feedback when there's client complaints. Continuous. We have meetings with our site managers every other month. So there's a lot that goes on, but the meal has to be low salt, it has to be minimal sugar, it has to be, all those dietary requirements. They're like good hospital food. They're not gourmet.
Pretty low bar.
Well, I think when you give it that sugar and salt, it does make it challenging.
I remember you said the past vendor you got hit by an oversight review that they can't be feeding potato chips and chicken fatties or whatever. I mean, people liked all those, but you had no choice but to get into compliance.
Our previous vendor was very accommodating of clients' requests to the point that he was not meeting the dietary requirements, which then jeopardizes our funding for the program. So we had to do a plan of correction, and at that time, the RFP was put out and they chose not to bid. This company did. Yeah.
So in your assessment, there's no need to look at other vendors. This is sufficient. You're not getting a lot of complaints. It's a good price.
No, really, people are, again, I think, in the very beginning, there was some bumps, but at this point, people are really very happy with the meals. Most of the meals are served 5 days a week, hot. In our northern area right now, it's a small route. That one, at this time, the meals are served cold, but we make sure that every person who's getting those meals has the ability to heat them up with a microwave. That's something we've checked on individuals. It's part of our assessment. If they didn't have one, we would definitely be able to figure out a way to get them one. So heating them up is not a problem. We actually get comments back from some of those individuals. It's kind of relief to them to get the food, but not have to be at the door every day at a certain time. It's easier when you're, traveling to a doctor's appointment that's an hour away. You can't always work that around your meal delivery. And so they tend to like the fact that they can store it in the fridge and heat it up when they need it. Some of those folks actually eat a cold lunch and then heat up our delivered meal at dinner time. So it gives them flexibility. And it varies, I can tell you, from county to county. There are counties that deliver 5 frozen meals once a week. We don't do that. We try to deliver a hot meal every day because it's also a contact and a well check to make sure that the person is okay.
Yeah, that's so important.
Other questions?
And I just want to say, I'd be happy to share the survey results with you at any time. It's really good comments.
I just want to be sure we're proactive so that I can defend us and not have to listen to. We're obviously all getting big raises too. I know.
Misconceptions, yes, thank you. So all in favor of HH 15?
Aye.
Aye.
Any opposed? Great, thank you. And HH 16, authorizing the chair and the director of Office of Aging to sign a contract for non-medical transportation for senior citizens.
I'll move it for discussion.
Second.
Is this giving the money to the SCAT van?
Yes.
Is that what this is kind of referring to? Okay, that's what
And this is a standard thing that you do when we're budgeted.
Yeah. I was thinking, what is SCAT van's real name? It must be Transportation Project Inc. Okay.
Yeah, didn't know that either.
Yeah.
And their ridership has increased this past year. So they're also growing in the demand for their services. Even with us implementing our GO-GO program, they still have more riders than ever.
And you just use some of your funding to help pay for some of their expenses, is it? Yes.
Yeah, we receive money specific for transportation.
Okay.
So this is the way we use it.
Okay. All in favor?
Aye.
Aye.
Any opposed? Great. Thank you. Thanks for the information.
Yeah. Well, and I just had a few things that I included in my report that if anybody has any questions.
If you got the report.
Yeah, right here.
Oh, stuff. Yep, there it is at the top. Okay, just.
Sorry, what is your role in the state association?
I'm a board member at large right now.
Nice.
Yes, yes.
Congratulations.
Thank you. It's a great group.
Great.
That's great. Any questions on her report?
It just.
No question, I guess, just to reiterate, you serve 65,000 meals for the year, so I think that speaks for itself with.
It's true. People probably wouldn't. That's a good point.
Thank you.
Thank you so much.
Brenda.
Okay. Deborah? Youth Bureau?
Give a quick update before we get into the resolution I have for the youth. Sure. If that's okay. For the Youth Bureau, just to kind of give you an idea of where I'm at right now, I just finished up with New York State with the 14 programs that the state funded in 2025. I just completed our annual report, which is basically just the numbers of programs, like the participants, that's a lot of demographics, what went well, challenges they had, help they may need. So the numbers that were reported to me for those 14 programs for youth was 2,772 youth participated in the 14 programs that OCFS funded. Going forward, as you'll see in my next resolution, we will have from 14, we'll have 20 programs that I'm looking to get approved on the resolution. So we can get the resolution.
Sure.
That's okay.
Excellent. So HH 17, authorize the chair of the county legislature and director of the Youth Bureau to execute agreements with various agencies to provide youth development services. We have
this.
I'll second.
Any discussion? We have the list.
You have more programs because you had more money, or that
Yep.
you were able to spread it across more?
A little bit more, some of the programs, and we did have more money this year, but some of the programs, as you'll see, some of the newer, smaller programs, like the libraries, for example, they requested a lower amount of money, so we were able to spread that out.
That was my question. The amount awarded is based on what they request.
Most of them were able to get, I mean, some people really asked for a lot, but for example, in the situation The town of Montezuma, it was our highest one. They had asked for like $30,000. So they're getting 20. Everybody else got about what it was for, and there were still about 6 or 7 programs that the advisory board opted not to fund this year for various reasons.
Oh, okay.
And after the resolution, if it gets approved and certified, is the point that I can work with the law department to execute contracts for them to begin the services and being reimbursed for the services. It's all reimbursable.
What is the Montezuma program?
They're doing different programs. Like, for example, they've done like skating, Disney on Ice, swim programs. They're doing like different field trips for the youth in the community.
Like summer youth
Summer youth, but they're actually doing it in the winter
Oh,
too, which is
wonderful.
nice.
Thank you.
Yep. All in favor of HH 18?
Aye.
Any opposed? Carried. Thank you.
Thank you.
There's some good bounce in there. Congratulations to those.
Yes, they're all very happy. So.
Yeah, sure. That's a fun thing to do, which is good. Okay, can I have a motion to adjourn? Oh,
Can I just, before, it's totally on us. Would you be okay with the committee be accepting if we brought forward, we had a board member to appoint that was nominated by the Board of Health in December, if we could bring it to the legislative meeting in January so that we'll have our ducks in a row moving forward?
yes,
Yeah, usually we put it on the agenda.
I think, yeah.
We'll get that in and we'll have it hopefully for Ways and Means also.
Okay.
And that'll be part of the big resolution.
Yes, it needs to be.
Yes, yep.
Okay, perfect. Thank you. Have a motion to adjourn?
So move.
Second?
All in favor?
Aye.
Thank you.